How does socioeconomic status impact women's mental health? Have you ever wondered how money and resources shape women's mental health? Socioeconomic status, or SES, plays a big role in this area. It includes factors like income, education, employment, and living conditions. Women with lower SES often face a higher risk of mental health issues, such as depression, anxiety, and substance use disorders. Financial strain is a major factor. When income is low, it creates ongoing stress that can lead to feelings of hopelessness. This stress can increase the chances of developing anxiety and depression. For instance, women with limited income often deal with social stressors like insecure housing and job instability. These challenges can weigh heavily on their mental well-being. Single mothers are particularly affected. They often relying on a single income, making them more vulnerable to poverty. This can lead to economic hardship and social isolation, which can worsen feelings of depression and anxiety. Many women also experience gender discrimination, adding another layer of stress that impacts their mental health. Access to health care is another important aspect. Women with lower SES frequently encounter barriers to mental health services. High costs and lack of insurance can prevent them from getting the help they need. This often results in untreated mental health conditions that can worsen over time. Living conditions tied to SES also play a role. Poor housing quality and unsafe neighborhoods can increase exposure to chronic stress. Women with lower SES often have limited social support networks, which are essential for coping with mental health challenges. Without these support systems, it becomes even harder to manage stress and anxiety. Research indicates that income is a strong predictor of depressive symptoms among women, especially in middle and older age. Lower income restricts access to resources that protect mental health and increases exposure to environmental stressors. For older women, poverty can have a more severe impact on mental health compared to men. Pregnant women facing low SES are at a higher risk for depressive symptoms during late pregnancy and after childbirth. Women dealing with multiple risk factors, such as low income and unemployment, are much more likely to experience significant depression after giving birth. From a cultural perspective, these mental health challenges reflected broader patterns of gender inequality and economic marginalization. Women's roles and access to resources have often been shaped by cultural norms that limit economic opportunities. Understanding how SES affects women's mental health requires acknowledging these cultural contexts. Practical solutions include policies that address economic inequalities and improve access to affordable mental health care. Community initiatives that respect women's cultural backgrounds can also enhance mental health outcomes. By providing culturally sensitive support, we can better meet the needs of women facing these challenges. In summary, socioeconomic status significantly impacts women's mental health through financial stress, limited health care access, and adverse living conditions. Addressing these disparities is essential for improving mental health outcomes for women.